Well, one child every day is identified with hearing loss. Now, a network of health experts has produced Australia's first national guidelines to streamline the medical management of children with hearing loss. To discuss this, I'm now joined by Dr. Valerie Sung from the Murdoch Children's Research Institute. Doctor, thank you so much for your time this afternoon.
Thank you for having me.
Firstly, can you take us through how many children in Australia suffer with hearing loss?
Around 12,000 children in Australia have hearing loss, and it's the most common congenital condition screened at birth, actually.
And how difficult, not only for a child, but for the parent and guardian?
Yeah, at the time of diagnosis, it's often a very stressful time, and a lot of these families face a lot of uncertainty. So, for example, they may ask questions like, why does my child have hearing loss? What should I expect of my child? Will the hearing get worse or will it stay the same? And a lot of the time, there's not much expectation of how to expect the child's future. So, in order to answer these questions for these families, we've developed these guidelines, hopefully so that the doctors can use them to order the right tests at the right time.
Can you take us through the national guidelines that have been developed to help streamline the management of hearing loss?
Yes, it's a group of doctors around the country, and we are hoping that paediatricians, geneticists and ENT surgeons as well as GPs can use them. And they are very practical. They have been designed to be individualised to each child according to the child's hearing, their clinical presentation, the available evidence, as well as the family's preferences, as well as what local resources are available. So we take into account a lot of different factors.
And, Doctor, why is it so important to streamline this process?
Well, it's because often we don't order the right test at the right time. So, for example, little babies just born with a hearing loss, they may be able to have certain tests that are easier to be done rather than later on, such as MRI scans. And also sometimes it's easier to pick up a diagnosis of, for example, an infection that can cause hearing loss very early in the piece. If we see these children later on down the track and they haven't had these tests, then normally it's quite difficult to get to the diagnosis.
You mentioned earlier the difficulties for families when a child is diagnosed. So how will this streamlined process make it easier for families?
Well, hopefully they can be given a more accurate answer of what to expect for the child if there is an accurate diagnosis. So, for example, if we are able to pick up something on the scan early on, we can predict whether, their hearing will deteriorate. And also sometimes we can counsel them on what kind of things they can do as they grow up.
Currently, how is hearing loss in children diagnosed in Australia?
Well, Australia's actually got a very robust system of screening for hearing loss, and most babies get the hearing screening at birth in the hospital, and if they don't pass that screening test, then they go on to have formal hearing testing, and this process is very streamlined, it's very robust, and it's really after the diagnosis that we feel that parents don't have the adequate information.
So what more then needs to be done, Doctor?
Well, I think doctors need to be aware of these guidelines so that if they see these children at diagnosis, they will be able to order the tests that are necessary at the time, and also to be able to reassure families once these tests come back on what to expect for the child.
An important conversation. Dr. Valerie Sung, thank you so much for joining me this afternoon.